So thank you for the introduction. Yes, we are part of the few Latin American representatives here. First, I want to thank the organizers for the possibility of sharing this project with all of you. And I'm speaking on behalf of a huge team of people, both from Argentina and Canada. And we'll be speaking on PrEP among a cohort of cisgender and transgender female sex workers in Buenos Aires, where I come from. So let's see if this works. Yeah. So to give a framework, this is where I come from in Argentina, back there in the south of America. We have 140,000 people living with HIV, with around 6,400 new diagnoses per year. And this number has been remained quite stable a long time, which is, we could say we have more diagnoses, but also it's not good. And the HIV prevalence, as you can see, it's quite different among the different populations. So the transgender women had the highest prevalence with 34%. Sex workers, which is where we are focusing our work, is 2 to 5%, while the general population had 0.4. So we've been discussing about PrEP. We heard a lot in the prior sessions, and female sex workers are at highest risk of HIV, not only because of their work, but also because several barriers that they have to access healthcare, including HIV prevention services. Oral PrEP in Argentina became available in 2021, initially in the public sector, and it's becoming more available slowly, and now it's available at the different health systems in my country. But we don't have long-acting PrEP. So Más por Nosotras, which is the name of this project, aim to describe the sexual and reproductive health status and income protection policies of female sex workers after the COVID-19 pandemic, and to assess the feasibility of a comprehensive prevention and care package in a way of pandemic preparedness view. And I would like to mention that Más por Nosotras is the name of the project. It says more for us, and it was a name to empower the community of being part of the solution. But also Más, which is, it's an acronym for Modelo de Atención en Salud, which is Model for Health Attention. So we had Más por Nosotras. It's a mixed method design that included several components. We had focus group, we had interviews to key informants, and we had a prospective cohort that was run at my site at Fundación Huésped in Buenos Aires, with the collaboration of the Ministry of Health of the City of Buenos Aires and a Canadian research team led by Dr. Wamsley. And what we are showing here is, within this cohort, we try to assess the knowledge and acceptance of PrEP in female sex workers in Buenos Aires. So we enrolled both cisgender and transgender female sex workers between June 2023 and March 2024. And at the first visit, we asked for some medical information. They also had a psychosocial evaluation. And we had a structured question on PrEP about whether they knew about PrEP, whether they had used PrEP before, and then if they were recommended, whether they accepted PrEP. And we performed those questions for everyone without known HIV diagnosis when they came into the clinic. We offered HIV testing, and PrEP was offered to all of them that tested negative. So this is the cohort that we had. We enrolled 200 female sex workers, 99 trans, and 101 cisgender women. As you can see, there are some characteristics that are pretty similar, but there are other, I'll see if I can, it's working? No. That are different. So the cisgender population tended to be older than the trans population, and the trans population tended to be more internal migrants, mainly from the north of my country, where mainly they leave their houses and their families many times because of stigma and discrimination issues. Both of them, they had 12 and 10 years on sex works. The transgender population, again, we had a higher percentage with over 20 sexual partners in the last month, and they were more frequently having the street as a work venue. And as we can see, about 58 and 53% respectively had at least one condomless intercourse in the last month. So within this group that I just showed you, we had 30 trans women and 2 cis women that had already an HIV diagnosis when they started participating in the study. Of those that had their test done within the study, we found 4 more trans women and 1 more cis women that learned about their HIV diagnosis during the visit. And we see that the prevalence is aligned with the national figures that we've seen before. So for those that tested negative, we already have some of them on PrEP, most of them transgender women. And this left us with 150 participants without HIV that were not on PrEP that we are going to see the results now. So in purple, we are seeing the trans population. In red, we are seeing the cis population. And as you can see, the trans population had much more knowledge on PrEP. The trans population had more prior use of PrEP. And when they were offered to start PrEP, definitely they were more likely to accept. For those that decided not to start PrEP, again, in purple we have trans women, and in red we have cis women. A lot of cisgender women consider it was not necessary. Some of them, the 30% of cisgender women, realized that it was necessary, but they didn't want to start. Then we have a few with some medical concerns, and we had other reasons. So we will explore on these other reasons. So the numbers, it's each time less and less and less. But for those that here we have, so those that were tested, and I'm starting here because it's something that you say, hey, these people were asked about PrEP. We had people that had the questionnaire then, and then they went into HIV testing. So that's why some of these participants tested positive, and they started treatment. Many of the cisgender will think about it, and we'll see what happened. And another 13% would postpone. So as you see, there's still a long way to go. The numbers are not very good, not for the trans community, not for the cis community, but they are even worse for the cis community. So as we said, not all women are the same. And I wanted to share some other things that came out in the focus groups and with some key informants interview. So which are the challenges that we face when we are seeing these numbers, when we want to implement PrEP in this population? So we have social and structural barriers. Stigma and discrimination are still there, are there because of violence due to the sex workers. And in Argentina, sex work it's not criminalized, it's not illegal, but still there's a lot of stigma around. And this is both at the society level and at the health system level. We are aware, as we are putting here, we had so far a pretty open legal framework for the trans community. Since 2012, there's in place a gender identity law, and this population is very empowered, but still they are facing a lot of stigma and discrimination when going to the health services and in the society itself. And this is for everyone, but mostly from the cisgender community. There are competing priorities, and I am not the first one saying this. We have discussed this during these morning sessions. Childcare is a challenge. Time availability to get the appointments, to go to the clinic, and to visit all the different places, because it's not integrated. It's not that you get contraception, HIV prevention, a pap smear at the same place. You get everything on a different session, on a different appointment. And there are other priorities. We have housing, food security, and they don't, and that's why I wanted to put this quote. One of the person that's leading one of the community organizations that we work with, she just said, we don't prioritize our health. So if we are starting there, there's a lot to work to do. And I would like to add some information that we obtained from another project with sex workers that they were working in my organization with leaderships at the different provinces in Argentina. And many of them didn't even had heard about PrEP in a country that they could access. And when they had the explanation on what is PrEP for, she said, okay, but it doesn't cover for other STIs, and it doesn't prevent pregnancies. So there's a lot to be done in all this population. And I like to include this figure because, as it was also discussed early this morning, we had a lot of intersection of different identities when we are talking about women, and in this case, about female sex workers. We have sex work itself, the gender identity, the HIV, whether they had child in care or not, all the economic situation, migration, mental health issue, which is a big problem, as in many other places, the education level. So we need to look at all this when we are thinking on strategies to reach this population. So in conclusion, our findings show that there are significant disparities in knowledge, in prior use, and in acceptance of PrEP between both the transgender and the cisgender female sex workers. The trans population, as I said, had more information, more power, and probably due to the high prevalence that they had of HIV in our country, there may be some targeted interventions that gave them more tools, so they have higher awareness and acceptance of PrEP, but still it was suboptimal. And definitely we need to think on targeted interventions to address the barriers to PrEP uptake, in particular for cisgender women, and think on how we can integrate services also and educate about PrEP benefits. And the community needs to be part of the response. Something that we learned throughout all the study and that we've been learning along all these years is that we are not going to get there without a community. And definitely they will be the key part to get to the people that needs to have the implementation of PrEP. So thank you, and I would like to recognize the work of all my team and all my colleagues, the community organization, the government of Buenos Aires, and Sharon, thank you.